Good morning all. Namaste. I, Dr. Megha Page, President of Indian Dental Association, Pune branch, welcome you all to this session. We have decided to reach the unreached, or rather to reach further in dental education and awareness, but this time digitally. Healthcare in women is an important topic. Women have to take care of their teeth, the gums, oral hygiene so that they can maintain good health by eating well. This is important in all stages of life and also throughout life. Navratri festival is here, so let us begin this session on this auspicious occasion. Over to Dr. Bhakti Datar, who is the Community Dental Health Convener of IDA. Thank you.
Thank you, Madam President. Hello everyone. This is Dr. Bhakti Datar. I am a consultant dental surgeon with a super specialty in public health dentistry. Today, as you know, we are going to throw light on women's oral or dental health. A healthy woman is the backbone of a healthy family, and oral health status of a woman undergoes changes as she passes through different stages of life, that is right from puberty to menopausal and postmenopausal period. Though these changes may not be very common, they shouldn't be overlooked as they can turn into potentially serious conditions if neglected. Hormonal changes in women's life have long been associated with gum diseases, and hence it is extremely important that a woman maintains a very good oral hygiene throughout her life. Untreated dental plaque or local irritants, commonly called as calculus or tartar, they are responsible to initiate the gum destruction. That is, to simplify, they are responsible for the ill health of the gum tissues. A condition which is called as pubertal gingivitis is seen during puberty, that is around 13 years of age in girls, when there is a surge of female sex hormones. It is the body's exaggerated response or the reactions to the toxins produced by the bacteria. Now here you will say that where are the bacteria? So these bacteria, they are present in the dental plaque or in the calculus or tartar that surrounds the neck of the teeth or which is present on the surfaces of the tooth. The clinical picture of these girls, it typically shows inflamed, irritated gums which are red, and they often bleed easily during toothbrushing or when touched or probed during dental examination. Also, some women who are very prone to develop oral ulcers or oral sores, they are typically seen to develop a pattern where the mouth ulcer, it recurs typically before the subsequent cycles. And now moving ahead, there comes the stage which every woman wants to enjoy and cherish these days. Womanhood is a bliss and motherhood is really a blessing. I urge here that all the would-be mothers or all wanting to be mothers to seek dental consultation before they conceive. This in time done dental checkup will rule out the abnormal dental findings, and then the diseased teeth can be treated well in advance in cases of planned pregnancies or if you are to undergo assisted reproduction. Now during pregnancy, a woman has to be really careful about her overall oral hygiene. Bleeding gums is relatively a common complaint during this stage. The condition is called as pregnancy gingivitis. As the name suggests, it generally gets back to normal once the baby is delivered. But if this condition really worsens, or if the problem of bleeding gums is giving a too much discomfort to the mother, then the removal of the local irritants or the dental plaque calculus can be carried out by a simple dental procedure called as oral prophylaxis, which can be safely carried out during the second trimester of the pregnancy, that is during 4th, 5th and 6th months. Do remember that neglected or untreated, deeply decayed tooth may put the mother and the baby at the risk of infection. Also, neglected gum disease may turn into a severe or advanced form of the gum disease called as periodontitis, which may predispose the mother at the risk of delivering preterm low birth weight baby. Next point. Now on a lighter note, women in their 40s must feel as in their second 20s. Regular exercise, proper diet, stress management, and thus overall fitness must be a focus. Women after 40 years of age, they are more prone than men. They are more prone to get diagnosed with myofascial pain or jaw joint pain or a syndrome called as Sjogren's syndrome, where typically dry eyes, dry mouth and joint problems are seen. Decline in the estrogens during menopause and postmenopausal period can precipitate oral discomfort. Tissue dryness is the major concern during this stage, and so is dry mouth. The most common complaints in elderly females are loss of taste or changes or alterations in taste, burning sensation in mouth, and hypersensitivity in the teeth. Dry mouth is a very irritating condition, and it's mainly a potential risk factor to develop multiple dental caries in elderly females, as saliva is a natural protector of the mouth. Also, elderly women are at high risk of bone loss, thereby loose and brittle teeth, and also receding gums. Low muscle tone of the face muscles cause drooping in the lip line or drooping cheeks, thereby giving that unwanted senile look on the face. So these were the clinical findings pertaining to women's dental health through all the stages of her life, that is right from puberty to postmenopausal period. And now we will see some simple useful tips regarding that. The first three are quite obvious regarding oral hygiene, that you have to brush thoroughly thrice a day with regular toothpaste and a fluoridated one intermittently, and always prefer an extra soft toothbrush. Secondly, a thorough mouth rinsing has to be carried out after every food intake. Thirdly, you can always gently massage onto your gums with clean fingers. Women who are very prone to have gum diseases, they may be prescribed some gum paints or gum astringents by their dental surgeon, depending on the condition of the disease. The regular use of these gum astringents or the gum paints will help the gums to be well tightened around the necks of the teeth, and thus preventing gum diseases. Next point, very important, that many pregnant women, even if they have some dental pain or complaint or any sign of dental infection, they simply avoid dental checkup simply due to fear of the dental surgical procedures or out of fear of harming the baby, which is really sad or unfortunate. I really urge here that if you are already diagnosed to be pregnant, or if it is very likely that you are going to be pregnant, you are really anticipating that good news in a very near future, then always inform your dental surgeon at the beginning of the first dental consultation appointment itself. Please mention this at the beginning of your conversation with the dentist, so that the necessary modulations or the necessary alterations can be done in your treatment plan, and also we can use only those medicines to cure your dental diseases which are safely used or which can be safely used during the pregnancy or lactation. Please take a note that pregnancy itself is not a contraindication for dental treatments. Those dental treatments which are absolutely necessary to be carried out during pregnancy for the health of the mother, they can be carried out during second trimester, and also with a very good rapport established between the patient, her gynecologist and the dentist. But again, I would definitely emphasize here that please seek dental consultation and the necessary treatment in cases of planned pregnancies. Now, next point, Very important again is balanced diet and regular exercise are the keys of good health. This holds true for each and everyone. Remember, your diet and particularly the nature of the food items you eat has an important role in good oral health. That is, simply what you eat directly affects your teeth. Remember to drink at least 2 to 3 liters of water per day, irrespective of the season, and always focus on a complete square meal rather than just easy, fast, or junk food, and also avoid frequent snacking. Choose the food items which are mainly juicy, crunchy, nutty, chewy, non-sugary or non-sticky in nature. Include a plenty of fresh fruits, vegetables, green leafy vegetables, sprouts, nuts, dry fruits and oil seeds in your diet. Always refrain from sticky, silky, sugary, refined food items which are mainly bakery items, confectionaries, cola drinks, or also tin canned food which is excessive of which have high amount of salt and sugar. And now my last point, keeping again holistic focus, that women must exercise preferably in morning sunlight for the natural uptake of vitamin D. Exercise at any age helps to mobilize calcium and phosphates towards the bone tissues, making them strong. Also do remember that vitamin B complex, vitamin C, folic acid, vitamin D, calcium and also zinc, they are the vital contributors for the good health of oral cavity. Now coming towards the end, remember your teeth are precious and smile is a distinct human power. Disease-free mouth is indeed an investment and it can be one of the major assets in women's overall health. I hope this holistic message will improve your quality of life and help you to enjoy every role womanhood gives us with. May it be a daughter, sister, wife, mother, your friend, or today's multitasker woman. Thank you.
Hello friends, this is Dr. Aparna Deshpande, Secretary IDA Pune branch. That was really a wonderful lecture delivered by Dr. Bhakti. She has given very useful tips to be implemented in day-to-day life. On this occasion of Navratri, let's take a pledge to focus on our health. Overall health begins at your oral health, that is dental health. So start taking very good care of your teeth regularly. Thank you.